Hello, my name is Megan and I'm a level 2 nursing student and I'm attending McMaster University. So this year in my clinical class, I'm required to record myself doing a skills check video of a catheterization. So my case scenario for this assignment is a gentleman named Mr. Mancini, and he recently underwent abdominal surgery and he's in post-op on the second day. So he's complaining of lower abdominal pain, and as a result, because of this, he has been unable to void for the past 8 hours. So keep tuned and watch me perform a catheterization video. Pretty cool. Good morning, Mr. Mancini. My name is Megan. I'm going to be your student nurse today. Can I please confirm your name and date of birth? I'm just going to check your name tag. Okay, great. And do you have any known allergies, including those to iodine or latex? Okay, good. So I'm just going to raise your bed up a little bit and tell you why I'm here today. Okay, Mr. Mancini, I'm here to insert a dwelling catheter on you today. This is per the doctor's order because you've recently had abdominal surgery and you've been experiencing some lower abdominal pain resulting in difficulty voiding. So I heard the last time you voided was 8 hours ago. Is this true? Okay. And have you ever had a dwelling catheter before? Okay, great. So I'm just going to relieve some of that pain that you're experiencing today by inserting an indwelling catheter on you. So I'm going to start by lowering the bed sheets to the foot of the bed. Okay, and I'm going to lower the bed rail. Okay, gonna ensure my garbage is near me, and it is. So I'm just gonna go ahead and put on my gloves. Okay, so if it wasn't done already, I would put a waterproof pad underneath the bed. This is to ensure that the bed does not get wet during this procedure. Now the waterproof pad is in place, so now I'm just gonna raise up or down, Mr. Mancini, just a little bit to expose your penis area. Okay, and I'm just gonna ask you to position your legs and your knees in a flex position like this. And just relax your thighs, please. Okay, and now I'm going to clean the perineal area with soap and water. I'm gonna use a baby wipe, and I'm gonna wipe the penis area in 3 motions going the same direction. And I'm just gonna be ensure to change the side of the wipe I use each time. I'm gonna dispose of that wipe in the trash, and I would get a towel and I would dry the perineal area off. Okay. So now I'm just gonna remove my gloves and I'm gonna perform hand hygiene. And now, Mr. Mancini, I'm just gonna put my catheter kit in between your legs. Or sorry, before I do that, I'm gonna open up my catheter kit and I'm going to open it up away from me. And I'm gonna make sure to maintain a 1-inch border for the sterile field.
Hold on, Wednesday. Oh my god, it's awful.
Okay, and I'm gonna set my tweezers, the border of that.
So much boring.
And I'm going to put on my sterile gloves.
Your pocket.
So I'm gonna be sure to not touch
Won't be back till Sunday.
the inside, or the outside of it.
Wednesday?
Okay.
Is Tyler in one? Is Tyler in one or no?
Okay, so now with my sterile gloves on, I'm going to grab this sheet and I'm going to extend my sterile field. So I'm going to put the shiny side down underneath the patient.
I died. Next day, yes.
Currently dying.
I know, I need a coffee.
Okay, and I'm going to grab my catheter kit and place it in between the legs of the patient. I'm going to grab the fenestrated drape.
For who?
My sister and my boyfriend. What it is? It's like
So I'm going to place the fenestrated drape over the patient's abdominal area and only exposing the penis area. And after that, I'm just going to prepare my sterile field. So I'm going to get my cotton balls ready, tweezers. I have this pee cup. I'm going to get ready and have open in case I need a pee sample from the patient.
you like get to like design them.
Have my syringe with the sterile water in it.
Pets on them, like with like
And I have my lube. Okay, so I'm going to pretend that I have my iodine solution here. I'm going to rip it open and pour it in the container with the cotton balls, and I'm going to discard that properly. I'm also going to grab my lube, open it up, and I'm just going to keep it in this basin. I'm also going to ask my classmate to open up the catheter kit for me so I maintain the sterile field. Perfect. And I'm just going to put the end of the catheter into the lubricant so it is ready when I need to. So I'm sticking it all the way down to the bottom. And I'm just going to leave it in there until I'm ready for it. Okay, so I'm preparing to clean Mr. Mancini's penis with the iodine solution. So I'm gonna grab the penis and I'm gonna grab my forceps. And I'm gonna grab a cotton ball that's dipped in the iodine solution, and I'm gonna wipe the penis again 3 times in a circular motion going the same direction and dispose of it.
Remember what's on there?
Yeah.
So it's like 3 fingers?
2
I don't remember how to do it, but
and 3. Okay, so I'm gonna pop my tweezers there, and I'm also gonna examine the penis for the penile meatus, so I know where to insert the catheter. Okay, Mr. Mancini, I'm preparing to insert the catheter. So I'm going to take it out of the lubricant. And when I insert it, you're going to feel a little bit of pressure, so I'm going to ask you to take a deep breath, okay? In 3, 2, 1. And I'm just going to keep inserting the catheter until I see urine output. Perfect. Okay, so urine is flowing out of the catheter now. And now I'm going to take my sterile water with my syringe, and I'm going to inject it into the catheter to inflate the balloon. I'm going to insert 5 milliliters into this balloon.
Yeah, it's just sitting in there.
Okay, so now that I insert 5 milliliters, I'm going to take out the sterile water, put it back on my sterile field, and I'm going to get the drainage bag and attach it. Or sorry, before I attach the drainage bag, I'm going to pull back to feel resistance to make sure the catheter is in place. And the catheter I used is a 16 French. So now I have my drainage bag, and I'm going to take off the blue cap, make sure I don't touch the tip of the drainage bag because that is still considered sterile. I'm going to attach this end onto the end of the catheter. Okay, and now that I have this inserted, I'm gonna grab some tape and I would secure this to Mr. Mancini's leg, ensuring that there is slack. And then after that, I would make sure that the drainage bag is hanging below the patient's waist, preferably on the bed and not hanging on the bed rail. That. Okay, Mr. Mancini, are you experiencing any pain at the moment? No? Okay. So I'm just gonna legs out. I'm gonna clean up all my stuff.
So it connects right to the end. So you flush the second time with water.
Okay.
And that way when you disconnect the bag, you don't have blood coming out of your
And
So then when you-
registration.
Do you flush it and then when you push that thing
Okay,
to lock
so
it? And
Mr.
then
Mancini, your
attach
catheter is inserted. So this is your means of going to the washroom now. So you don't have to get up and go to the washroom. This will eliminate your urine from here.
it? Oh, okay.
And here is your call bell. If you have any problems,
the
please
needle
feel
end,
free to
though,
call
right?
me.
Or the
Good afternoon, Mr. Mancini. It's me, Megan, again. I am your student nurse, and I have good news for you today. So your surgeon assessed you, and you are going to be, your catheter is going to be discontinued as per order of the surgeon. It seems that you have been able to ambulate and walk more frequently, and your urine output has been adequate, so your catheter is coming out. Okay, so Mr. Mancini, can I please confirm your name and date of birth? Okay, great. And do you have any known allergies?
yeah, I still have to edit mine.
Okay, great. So I'm gonna go ahead and put your sheets down to the foot of the bed, and we're gonna get this catheter out of you.
100 takes. Like every second's gonna be a new shot.
So I'm just gonna raise your gown up a little bit. So I'm gonna go ahead and put on my clean gloves, which I already have done, and I'm gonna empty the catheter, the bladder in. I'm gonna take it off the side rail, and pretend this is gonna be full. So right now I'm gonna look at it, and it is measuring 630 milliliters that Mr. Mancini has voided. Now to drain this bag, I'm going to take this part. I'm going to unhook this part from the catheter bag. Perfect. And I'm going to make sure to alcohol swab this area before I drain the urine. And I'm going to drain the urine into this basket. So when I'm draining this urine, I'm looking for the color, the smell, anything abnormal. Again, I would measure the output of the urine. Make sure to clamp this back into place, and I'm going to put another alcohol swab on it again and insert it in. So now that the drainage bag is empty, I'm going to disconnect it from the catheter.
One person can't answer it twice, so then everyone has to like say something.
So I'm going to disconnect this and dispose of it properly. So now I have the catheter running into this bin, and I'm going to grab my syringe, and I'm going to deflate the balloon. So originally I put 5 milliliters in, so that is what I'm expecting to get out. Okay, and I will gently pull the catheter out. Perfect, and I would dispose of that properly. Okay, so I would take, after I measure the voided urine, I would take this to the restroom, dump it in the toilet, and then flush. Also just going to clean up Mr. Mancini. And I'm going to dispose of all of this properly into the correct bin. So pretend I threw that away. I'm going to cover up Mr. Mancini. Covers back
He's not a
up.
tall guy, I was tall. Yeah, like I don't know what
Mr. Mancini, before I go today,
I wonder
do
if it's-
you have any
Yeah, he's like
pain?
getting. Do you know what it's called?
Okay, so I'm gonna give you your call bell. If you need anything, please call. When you go to the washroom for your first time, it said that we want to measure your first void on your own. So when you feel the need to go, please ring the call bell and we will come and measure your output there. Okay, so after that, I would take off my gloves and I would dispose of them. And instead of doing hand sanitation, I would go and wash my hands with soap and water. And this is because you've been in contact with bodily fluids. So you just want to make sure your hands are free from debris and stuff. So it's really good to wash your hands.